Welcome back to Your Health in Your Hands. And if you're just joining us, we're talking about cardiovascular disease, specifically about why women tend to die more often from cardiovascular disorders than men do. And in the last segment, we talked about why women are not as a woman's heart attack is not well recognized the way a man's heart attack is because of different patterns, and that medication is being made for specifically for men as opposed to for women in mind. So this segment we're going to be talking about we're going to show you some of the signs that we see from research in how the woman's arteries look as opposed to the man's artery, so you can just see the difference. But before we go on to that, share some stats. 2 to 4 times more deaths occur in women than men from cardiovascular disease. More women die within the first year of a heart attack than men do. Now you see this graph in front of you. It shows the wide disparity. And so the woman's slide is the one in red, and the one below is the green. The blue one is below, and that's for men. And you can see there's this huge disparity between the two of them. And so you want to pay attention to that. Some other things that we've seen. Strategies used to prevent and treat cardiovascular disease were developed in men, for men, and by men. We've mentioned that before. Tests used to diagnose a heart attack were initially designed and perfected in men. In research, in animals, it goes as far as animals. Animals and humans used in research are predominantly male. Women tend not to get as prompt and aggressive treatment for their heart attacks or angina, which is pain in the chest, because they are not as readily recognized. The symptoms and signs are not as regularly recognized. So we've talked about that as well. So in front of you, you're going to see another graph. So with the one above, you see the men pattern of heart disease. What they did is that they injected some dye into the blood vessels. It's called an angiogram and angiography. So it outlines the blood vessels, so you can actually see what's going on and can see where the blockage is. In men, it's pretty obvious. You can see that. There's a blockage where there's a blockage. You can see that there's plaque beginning to build up. In women, the plaque doesn't build up as much inside, but more surrounding the blood vessel. So again, these are not as obvious. Another thing they found out is that women's arteries, especially the ones around the heart, are smaller in size than men's arteries do. Men's arteries are around the heart. And so these are the things. So you can see why researchers will be thrown off, because what they are used to seeing in men, whom they've studied much more than women, they don't see that in women. So they tend to, let's say a woman has had a chest pain, for instance, and they do a test. They may not be able to see those signs as readily as they would see in men, because the pattern is different. So there's, like I mentioned in the last segment, there's this huge uprising, so to speak, and it's gaining momentum, and it's being led by white female doctors to say, hey, listen, let's pay attention to this demographic. Let's pay attention to women. Let's do more research in women. Well, not just in women now, but in female animals as well, so that we can actually get a clearer picture of what's going on in women and how women are different, and so that it can begin to create and establish protocols that are specifically with women in mind, establish protocols for medication, protocols for intervention by doctors. Remember, every year, Americans suffer more than 1.5 million heart attacks and strokes. Nearly 44% of African American men and 48% of African American women have some sort of cardiovascular disease that includes heart attacks, heart disease, and stroke. Those are the statistics that they have found out in the US. Unfortunately, we don't have those same statistics, but we can extrapolate. You can't look at a statistic like this and say, well, it doesn't concern me in Africa. You can't say that, because there are parallels. As a matter of fact, they are doing similar research. They're finding out similar results in South Africa. So South Africa obviously has a much more advanced medical system, and they have more research that is being done. And they're seeing it. They're comparing the whites South Africans with the black South Africans, and they're seeing these same things come up. So there goes your excuse. Your excuse is mute, null and void. you need to pay attention. And again, another thing we see, and this seems to be a source of pride in that I see in Africans, Nigerians, is like they look at is the weight issue. And I know this is a sore point, but we have to address it. We see that women tend to have more weight in general than men do. Women tend to put on a lot of weight, especially after pregnancy. Weight, excess fat in the body is an issue. There's no other way we can look at it. Yes, it can cause mechanical problems like you weight on your knees and you have knee pains and hip pains. But more important than that is that fat is itself an active organ that produces chemicals that specifically damage the cardiovascular system, that specifically damage the lining of the cardiovascular system. And we said over and over and over again that the main cause of heart disease is damage to the lining of the blood vessels. So women are more subject to that, and they have the greater chance, because if they're overweight, they are above the age of 50, when the estrogen levels, estrogen tends to protect. Estrogen is the female hormone. It's also available in males, but estrogen also helps to protect. Women have more estrogen. Estrogen helps to protect against heart disease. But when you get to menopause, your estrogen levels begin to wane. So you need to pay attention to these things. Women, I would say you need to check your blood pressure regularly, probably more than men do. Women are always so much more concerned about everybody, their family, their husband, their kids, their extended family. They're always worrying about all these other people, and they don't really take time to take care of themselves. So I'm giving you permission to take care of yourself. Check your blood pressure regularly. As soon as you have these signs, these symptoms, this unusual pain, maybe in your chest or in your stomach, or you're feeling excessively tired or fatigued, go and check with your doctor. Ask questions. Let them know that you are concerned about your health, and don't let up until you're sure that you have been addressed. So please, I'm going to end this segment by making this more. I'm going to implore you, please take care of your health. Please ensure that you are aware of these things. Again, you can send us questions. Thanks again. See you in the next segment.